Hi guys, welcome to another episode of the Conceive Podcast with Siri Mabo. Today I'm going to be answering a couple of questions that have been sent to me both inbox and even on my chats, and I've just not gotten the time to get to the questions, but today I'll be answering some of those questions. I'm going to try to separate it so that the questions about sickle cell I answer them on one day, and then the questions about autism I answer on another day, just so that it doesn't get very confusing for everybody. Let's start with the sickle cell questions. The first one: what is the difference between a bone marrow transplant and stem cell transplant? So this question, the answer is there's no difference. They are the same thing. A bone marrow transplant is the same thing as the stem cell transplant. Bone marrow has stem cells in it. When it's harvested, then they do a filtering process where they get the stem cells out, and then they transplant that into your body, and that's what basically consists of the transplant. So the two terms are interchangeable and it's the same thing. And then another question, this one just asks what is the cost of a bone marrow transplant? Okay, now this question, almost everybody that has asked me in my inbox is always like, what is the cost of a bone marrow transplant? And this question, it's kind of hard to answer it because there's not one ballpark price for a bone marrow transplant. It's different depending on where you are and also on what the circumstances may be. Like if the transplant goes smoothly without any complications, the cost is different. And then if there are any complications, maybe needing ICU or any other treatments, it could make the cost go a little bit higher. So I'll start with the US. In the US, the bone marrow transplant can range anywhere from $600,000 to about $2 to $3 million. And again, it could be higher, it could be lower. It's just, this is the range that it usually falls within. So usually insurance covers a good part of it depending on the insurance you have, but there's always still the out-of-pocket cost. Then there's your deductible. Once you meet your deductible for the year, then the rest is covered. So all of those come into play. Like in our case, for Brian's transplant, Brian had a lot of complications. He needed to be in the ICU for over a week. He had so many other things that went on. I'm telling you, Brian had so many complications. We had the bill from Brian's transplant at the end of it all, and it was $2.4 million. Everything. Insurance covered the most of it, thankfully, but that's about how much it cost us for Brian. And for Brandon had less complications. His was a lesser stay. He was in the hospital for like 5 weeks and he didn't have too many complications, so his was $850, I believe. I'll check that bill again, but it was about $850,000. I don't know. Then if you are in Africa, your best bet at the bone marrow transplant is in India. Like in India, they've been doing it for a long time and they have proven results for success. And so if you are wanting to do a bone marrow transplant in India, I also forgot, it depends on your match. If you have a half match donor, which could be a mom or a dad, if you have a full sibling donor, or if you have a donor from the registry, all of these play a big role in the cost of a transplant. So both in the US and in India, this is a big factor too. So in India, if you have a full sibling match, we are looking at anywhere from $20,000 to about $30,000. And then if you have a half match, again a sibling, a half match sibling, so they are not a full match for you, it could be 50%, 60%. Or if it's a parent that is donating to your child, then it could range anywhere from $35 to $40, $50,000 if you're doing it in India. I had a quote from a couple of the tourism, the medical tourism agencies, but these were codes that were given based off of the patient's weight, height, size, all of that. So they all play a factor in that. But in India, you're looking anywhere from $20,000 to about $50,000 or $60,000. So that is not so bad if you ask me, but I know it's not easy to come up with that. So, but that is that. Another question that someone sent me, this says, when you get a bone marrow transplant done, does it change your child's DNA? No, a bone marrow transplant does not change your DNA. Like, when you get a bone marrow transplant, you still have SS as your DNA, as your genotype. So SS is still your genotype, but your phenotype changes to AA or AS depending on who you got your donor from, like who was your donor. And let me explain this. Your genotype is what you were born with, the genes that your parents passed down to you. That's your DNA. So that does not change. Your phenotype is how you present. So your phenotype is like, my son had a bone marrow transplant. He got his brother's bone marrow in his, that's what produces his red blood cells, his white blood cells, everything. So now Brian and Brandon are both AA because Nathan is AA and Naima is AA. So their phenotype is AA. Their bone marrow produces only AA and they're not producing AS or sickle cells anymore. But if they were to get married in future and need to have like kids of their own, their genotype is still SS, so they will still need to marry someone who is AA to be able to have kids without sickle cell. I know that is a little bit confusing, and I'll make another video with the diagram to kind of go more in depth on that. But basically, your genotype does not change. You're still SS, but your phenotype changes and you no longer produce sickle cells in your bone marrow. That's confusing, but we'll get to that. And then this question, the lady asks, when you have a bone marrow transplant, do they address fertility issues? And if so, what can we do to prevent that? So with the bone marrow transplant, we have the chemotherapy that is done to wipe out your bone marrow so that your body is ready to receive the new bone marrow. It's very high doses of chemo, so it can cause infertility, and it's about 60 to 80% that can cause infertility. And unfortunately, that is just one of the side effects which you have to know before you get into the process. Now, what do we do to address these issue? Here in the US, they have something where, I mean, if the person is already like age 13, 14, where they can actually produce sperm, they try to get you to have sperm and then they save it before they start your process. But if it's a child like us, they get something called testicular tissue. They do like a little surgery. They get some tissue from the testicles, which they save and preserve. And in future, they hope to transplant it back into the scrotum and then hopefully get sperms produced. This is still very experimental. It's not really proven to work yet, but that is the best bet at preserving fertility for kids that are younger and they don't produce sperms yet. And then for the females that go through transplant, if you're above like 12, 13, where you're already ovulating, they can actually get some eggs to save. But if you're still young and you're not able to produce like actual mature eggs yet, they get one ovary out. You know, you have two ovaries, the left and the right side. So they do like a minor surgery. They get one of your ovaries out and then they save it. And hopefully in future, when you're ready to start having kids, they can, you know, transplant it back and then you're able to produce eggs and have kids of your own. Again, this is still experimental. They don't really have cases where it's really worked yet, but this is the best bet as of now. So that I think that's about it for the questions on sickle cell. But again, like I've said before, sickle cell disease is a genetic condition which a person gets from both parents. You have a defective gene from both of your parents and then it causes sickle cell disease, you have a 25% chance of getting sickle cell disease if both of your parents are AS. If your parent is SS and the other one is AS, you have a 75% chance of getting sickle cell disease. And if both of your parents are SS, 100% chance of being sickle cell. And then the best bet is to have either one parent AA and one AS, or both of your parents AA. That's your best bet.